Alrighty, hey guys, I'm Vanessa Fernandez and I did my internship at Orthopedic Physical Therapy. So, some of the site information, we have two locations throughout Corpus Christi, our Spawn Drive location and our SPID location. I'm currently at the Spawn Drive location, which is home to 3 physical therapists and 1 physical therapist assistant. Our technicians work with their patients one-on-one throughout their programs. Some of the things that includes is post-op recovery, manual therapy, and sports injuries. Some of the things that I really like about our clinic is that there's a treadmill deloader and cervical deloader. Treadmill deloader is great for those who have lower back issues and lower extremity problems. Our cervical deloader is great for those who have neck injuries. Some of the objectives I've dealt with is patient data intake and flowcharts. These flowcharts are what the physical therapist and physical therapist assistant put together for our patients. This is all their exercises and home exercises. So we can see how the patient is doing throughout the recovery process. Throughout, you really want to see a steady incline in weight and or no weight, depending on exactly what they need to do. So like I said before, we take our patients one-on-one through their programs. Another big thing is COVID protocols. Because COVID's so big, our cleaning techniques are even bigger now. We ensure that there isn't that many people in the clinic at a given time. That way, our patients feel safe and that they have a good place to be with proper social distancing. Another objective that I've learned is assistant with the front desk. So this includes collecting copays, scheduling, and answering the phones. One of the best experiences I've had so far is a patient telling me that I've helped them through tough times. So of course, no one really likes physical therapy because it hurts them. And so I always try my best to have our patients smiling and always give them a smile. Even if I'm having a rough day, I try to keep a smile on my face just to help them get through. Another thing is building bonds with those patients. These patients come in at least 3 times a week, so we really get to know them on a personal level. Here we have one of our patients. He was one of the best patients I've had so far. He wanted to wear superhero shirts, so we all wore superhero shirts along with him on his last day. One of the most challenging experiences I've had so far is language barrier. Being in South Texas, Spanish is a big language here. Unfortunately, I do not speak very much of it, so it was very hard to communicate with those Spanish speaking patients. Some of them came in with translators, some of them did not. So it was a little bit more difficult, but I can say I have started to learn a lot more Spanish. Another most challenging thing is overcoming COVID. Currently, our front desk lady went out with COVID and we had to learn all the ins and outs of the front desk. We were trained in the beginning to deal with the front desk, but not on such high levels as this. It was very demanding and very, very difficult. Although I did not like it, I do appreciate it because now I can say I learned a lot more about insurances and copays. Things I would do differently is definitely sit in on more evaluations. I started off doing great with trying to get an eval in at least once a week, but as time went on, I kind of slacked off, which I want to get back into seeing evals because they're pretty cool and seeing exactly how and what goes into making a patient's program. Another thing I would do differently is reading into patients' chart notes to ensure there's no restrictions. Sometimes some of the doctors, their ordering doctors, do not want them to go more than a 90-degree flexion or overhead stuff, just depending on exactly what is going on with them. Some of them are just post-op, so it's really hard for a lot of them to do exercises. So I just really need to start looking into that more often. Most important professional lesson I've learned is definitely insurances and how they work with billing. Another thing that I've learned is different ways of communicating with patients. Some patients do not want to be there, and it really is difficult to make them laugh or smile, or even just want them to finish their programs. Some of them will just walk out on you on days that they don't want to be there, and it's kind of weird, kind of awkward, but it happens. And then another thing that I've learned is how to handle patients that aren't very nice to you. Sometimes some of these people just take it out on you, even if they're having a bad day or a good day. Some people just aren't having it, and you have to be able to have a backbone and not get in your feels too much. And another thing I've learned is always have fun. Here you see me and my coworker TJ. We built a face mask out of tortillas that we had that day for lunch. It was probably one of the best tortillas I've had in a while, to be honest. And yeah, that is my internship site, and that is my experience. Hope y'all have a good one.